Welcome, everybody. Welcome to Vet CBD and CBD for Pets. So if you are here to find out how and what and when and why to use CBD for your pet, then you're in absolutely the right place. I'm your MC for this evening. This is Jason Turner. I'm Chief Marketing Officer of Three Wells. But more importantly, I am your MC for this evening. So I'll be taking you through this evening's events. And shortly, I'm going to be turning it over to Dr. Tim Shu, who I know you're all waiting with anticipation to meet and hear from. So here's what's going to happen tonight. I'm going to share with you some of the logistics of what's going to go on tonight. Then we're going to get right into how and what and where and why, et cetera, to use CBD for your pets, for healthy, happy pets. And as a pet owner, I got to tell you, I've been talking to Dr. Tim Shu prior to this, obviously, and man, I learned a lot, and I thought I knew a lot, but I really didn't. And Tim filled me in on quite a bit, and I know he's going to share all of that and more with all of you tonight. So we're going to go through that. Then what's also going to happen is we're going to have a Q&A session at the end, and we'll answer all the questions we can possibly answer tonight. We'll do our best to get through all of your questions, and if we don't, maybe we can arrange a follow-up afterward. And for all of you that stick with us tonight, we have Dr. Tim and Vet CBD has provided a discount code for anyone that's interested in getting trustworthy products from Vet CBD that you can use for your pets. But you got to stick around to the end, and you'll see that. So what also is going to happen is Dr. Tim is going to share a bunch of information with you and insights with you, and we'll be going back and forth between some screens, some informational screens, but we're going to pretty much stick to the video tonight. Now, one of the things I do want to draw your attention to is there is at the bottom of your screen here, there is Zoom, in Zoom that is, there is a Q&A, and that's where you click to enter your questions. If you try to chat them, we may not see them, so please use that Q&A function. And with that, there are a couple other logistics that we're going to go through tonight, and you all see me looking off to the side a bit. That's just because I have two screens going. No worries. I'm still with you. So this will be replayed, and you'll be able to get it from Vet CBD as well as on Three Wells. And on the Three Wells, you'll see it right on the homepage starting tomorrow afternoon. You'll be able to click on that and get right to the replay of this. So if you miss anything or you want to catch up, that'll all be available to you. So I'm going to share my screen with everyone right now and show you a couple of things that are important because, really tonight has been brought to you by two companies, Three Wells and Vet CBD. So Three Wells is a website, and it's the first and only website dedicated to those 40 plus to demystify CBD and cannabis, etc. And of course, not only, as you can tell from tonight, it's not only for we, the humans, but also for pets. So we really are dedicated to bringing health and happiness and joy to the lives of everyone 40 plus. And of course, a big part of that are our pets. And being a pet owner, I can attest to that personally. And of course, tonight is also brought to you by Vet CBD. And look, at Three Wells, we're very particular about who we bring onto the site and who we work with. We only work with companies that we know and trust, and they can prove that whatever they promise, they're able to actually deliver on. And with Vet CBD, when we looked at them, we saw that they're using very natural ingredients. They're third-party tested through credible labs. So all the products you're giving to your pets are trustworthy, and we've looked at that and we've made sure that that is truly what's happening. And their products are full spectrum. So some of you may know what we mean when we say full spectrum. Others of you may not. I guarantee you Dr. Tim is going to bring all that to light and share that with you today, what is full spectrum, because it's a really important thing. And the other thing we really like is that Dr. Tim Shu is a licensed veterinarian. He's a practicing vet. He's not someone who's just coming up with products because he thinks they're great. He knows they're great because he's a licensed veterinarian. So that makes a big difference. He knows exactly what pets need and how to get them what they need. So all that said, that's why we have a lot of faith and trust and comfort in Vet CBD. So Dr. Tim, I keep referring to him, but who is the mysterious Dr. Tim Shu? Well, Dr. Tim is the founder and chief executive officer of Vet CBD. as I mentioned, he is a licensed and practicing veterinarian. He graduated from Texas A&M in Veterinary School of Medicine. So hence that's where he got his degree. And he has been working for many, many years with CBD, and specifically with CBD for pets. And he's a bit of a celebrity. You can see on my screen here that where's he been in? Today Show, Vox, NPR, and I only took a few of the shows that he's been on. So we're lucky to have a bit of a celebrity with us tonight. I've seen some of his other stuff, and it's been phenomenal. So here's what you're going to learn tonight, and here's what Dr. Shu is going to run through in about 10 seconds from now. And that is where to start, because that's one of the big questions we all have as pet owners is, where do we start? Where do we get the product? What are we looking for? What's CBD and THC and hemp and all that can get confusing. Dr. Shu's going to clear all of that up for us. What to look for in trustworthy products. How do you read a label? What should you be asking? What questions, etc. Because you want to make sure you're giving your pet the best possible stuff, right? And then third is how to choose what to give your pet. So for, they may have a specific need, and what best matches their need. And then how much and how to give your pets the right amount of CBD. So you're going to find out all of that and much, much more. And right now, I am going to turn it over, and I will stop sharing my screen. I'm going to turn it back to Dr. Tim Shu, and he is going to get us through this evening. So, Dr. Shu, back to you.
Awesome. Thanks, Jason. Really excited to be here. So appreciate that. Just real quick, I actually don't practice anymore. So when I started the company, went into this full time, and it's turned into more than a full-time job. So hats off to all the veterinarians out there that are practicing, and the veterinary nurses. Those people do an amazing job, and what they do is just absolutely wonderful. So when you guys get a chance, do make sure to thank your veterinarians and veterinary technicians. They do some amazing work out there. So, like Jason said, one of the things that we want to talk about tonight is, how CBD can be beneficial for your animals. A lot of us have heard about, CBD. It's been quite the craze over the past couple of years, and rightly so. So there's been a lot of claims about what CBD can be used for, what it's not used for, and so those are things that we'll talk about because we want to make sure that you guys understand from a scientific perspective and from a medical perspective what it has been shown to be beneficial for. One of the things that is really easy for people to remember is the acronym PAINS. So I used to get this question all the time: is what's CBD used for? What's cannabis used for? What's this plant good for? And the evidence, whether it's preclinical studies or actual clinical studies in humans or animals, have shown that it can be very beneficial for a number of conditions. And so what does PAINS stand for? It stands for pain, anxiety, inflammation, nausea, and seizures. So that's just a real quick way to help people understand what cannabis and hemp and CBD is good for. Now, that's not to say that that's the only things that it can be used for. Certainly, we're finding out a lot of amazing different uses for cannabinoids. For example, you can be used for spasticity associated with people that have MS. We're looking at using cannabinoids for things like neurodegenerative diseases like dementia, Alzheimer's, and then degenerative myelopathy. So there's a lot more out there that is being investigated in. But to help people have a real quick understanding of what it's really good for: PAINS, PAINS, pain, anxiety, inflammation, nausea, and seizures. And a lot of people have questions about, they've heard it can be used for cancer. And the thing that's really interesting about cannabinoids and cancer is that there's been a lot of preclinical studies looking at its uses. And what we've seen is that when the preclinical studies have been done, and what that means is they're looking at primarily lab animals like mice and rats, or they're looking at test tube environments or petri dishes, is that cannabinoids like THC and CBD have anti-cancer properties. But there haven't been any large-scale clinical studies, meaning they haven't tested cannabinoids in human patients or pets in a setting that is particularly looking at these cannabinoids for cancer cases in clinical studies. That's not to say that it can't benefit. It's just that we don't really have any hard evidence one way or the other. We've certainly seen and heard about anecdotal cases, but that's going to be one of the most exciting things within the next 3 to 5 years is the potential benefits of cannabis and cannabinoids. So I'm going to stop there. And then Jason, if you want to direct the slides on the next topics, we can just go along from there.
Why don't we talk about the endocannabinoid system, or ECS, because that's one of the big things that I know impacts both humans and animals. You want to get into that?
Yeah. So the endocannabinoid system is one of the most fascinating systems. And what's really cool about it is that this is a bodily system. So when you think about the other bodily systems, whether it's the nervous system, the cardiovascular system, the endocrine system, the GI tract, those are all body systems that we've known about for hundreds of years. The endocannabinoid system is another body system that we only knew about since the 90s. And so this is a very, very recent discovery. And what's fascinating about this is it's intertwined with a number of different functions throughout our bodies. And it's not just humans that have the endocannabinoid system. Animals have it as well. And this endocannabinoid system, like I said, is found all throughout the body, and it regulates a number of different processes. Its primary function is what we call homeostasis. And, what's homeostasis? It sounds like a fancy word, but basically what it does is it provides balance. So it prevents there from being too much or too little of something. And what we've seen thus far is it has a number of roles in helping to regulate things like appetite, mood, memory, movement, inflammation, and even reproduction. So the endocannabinoid system is one of the most fascinating findings within our lifetimes when we think about medicine and science. Now, the endocannabinoid system consists of 3 parts: the cannabinoid receptors that cannabinoids bind with, the endocannabinoids, which are cannabinoids that our own bodies produce. So a lot of people don't realize this, but our own bodies produce cannabinoids. So, it's not just the plants that have the cannabinoids, but our own bodies make it as well. And we need these cannabinoids to be able to function normally and be healthy. And the third component of the endocannabinoid system is the enzymes that make and break down these endocannabinoids that our bodies produce. So the endocannabinoid system, like I said, is one of the most fascinating discoveries within our lifetime. We're at the tip of the iceberg in terms of understanding the endocannabinoid system and its implications in medicine. And we know that we're at the tip of a very, very large iceberg, but one that we don't even know how big it is. So what I always tell medical professionals is, imagine if we've just discovered the endocrine system yesterday and we just started learning about what things like hormones are, what insulin does, what testosterone, what estrogen does. That's where we're at right now with the endocannabinoid system. We're discovering things like endocannabinoids like anandamide and 2-AG, and we're learning about what they do and how important they are. And then we're learning about cannabinoids that come from the plant and how they interact with our body and the endocannabinoid system and how they can be used therapeutically.
So, Tim, how about why don't we move into, there's this big question about THC, CBD, hemp, marijuana, weed, all of this. You think you could help clear that up a bit, and I can bring up the screen for you, the visual that you put together for us.
Yeah, absolutely. So when we're talking about marijuana, weed, hemp, all these different names, we have to understand that they are all cannabis. And that's the name of this plant, is Cannabis sativa. Now, when it comes to what's marijuana and what's hemp, basically there's a legal definition in terms of the THC threshold. So plants that have greater than 0.3% THC are considered marijuana. And then hemp is what's considered having less than 0.3% THC. And so that's considered hemp. And so hemp was actually legalized federally by the 2018 Farm Bill. And so that's why we see hemp available now in the common marketplace, whereas marijuana still has to be sold through state licensed dispensaries.
All right, so Tim, that clears up the marijuana, the hemp, the et cetera. But we hear a lot about, okay, should a product have a little THC in it, or should it be purely hemp? And should we be looking at the entirety of the plant. And you and I were talking, and you referred to that as full spectrum.
Right. So when we look at CBD products, we break them down into three categories. So there's one that's called full spectrum, another that's called broad spectrum, and a third that's called isolate. So, let's start with isolate because that's the simplest to understand. What is isolate? It's pretty much just pure CBD. So anytime you have an isolate of a product, it's just purely that product. So the CBD isolate that you get, it's 99+% CBD, which means that it doesn't contain other cannabinoids. Now, on the other end of the spectrum, we have what's called full spectrum CBD. Now, this is the purest, this is the extract that is pulled directly from the plant. And it contains a number of different cannabinoids in addition to a lot of other components that the plant has. The cannabis plant has been documented to have over 500 different components to it. And there's been shown to be over 120 different cannabinoids. So there's a lot of active components in the cannabis plant. And when we extract the oil from the cannabis plant, what we have is what's called full spectrum. And that contains a number of different cannabinoids. So for example, like you see on the screen here, not only does it contain CBD, but typically it will contain CBC, CBG, and also varying amounts of THC as well. So in the hemp plant, it's going to be having less THC than in a cannabis plant, but that's what we consider full spectrum. And in the middle is what we call broad spectrum products or broad spectrum CBD. And what that is it's a chemical process that removes the THC. Now, oftentimes that chemical process, when they remove the THC, they tend to remove bits and pieces of the CBC and CBG and other cannabinoids and other components. Why is that important? The reason why that's important is because studies have shown that full spectrum CBD actually provides greater therapeutic benefits at lower doses compared to isolate CBD products. And the thing that was shown in one really interesting study in mice, and when they were looking at inflammation, was that isolate CBD actually had a bell-shaped curve, meaning that if you gave too little or if you gave too much, you actually got less of a therapeutic benefit. You actually had to find the sweet spot to be able to get the most therapeutic benefit out of it. Whereas they tried something that was full spectrum, and what they found was it either went on a linear curve or it plateaued, meaning that at higher doses, they either got a plateau of the effects or they actually got greater therapeutic benefits at higher doses. And so this is not just one study that looked at full spectrum product versus an isolate. There's been a number of different products or different studies looking at the difference between something that's full spectrum and isolate. They've done it in seizures, they've done it in inflammation and pain, and they've also looked at some preclinical studies looking at full spectrum product compared to isolate for things like breast cancer cells. And time again, these studies have found that full spectrum actually outperforms isolate. And full spectrum is also sometimes known as whole plant extract. But what's really important is that you look at what's called the COA. The COA is called the Certificate of Analysis. And what that is a lab report that tests for a number of different things. And one of the most important parts of that lab report is testing for the cannabinoid profile. And so what it'll do is it'll test for the amount of cannabinoids in that product, whether it has CBD and how much, whether it has THC, CBC, CBG. And if you have a COA that is only CBD, then you know it's made with an isolate. But if you have a COA that has multiple cannabinoids in it, including small amounts of THC, that's how you know it's from a full spectrum product.
So, Dr. Shu, there's a couple of things I want to make sure, and had a couple of questions on here. So, you're recommending that we use as pet owners full spectrum product, and we seek that out when we're looking at the store shelves.
Right. So full spectrum product, it does have greater therapeutic effects. Now, that's not to say that broad spectrum or isolate products don't have those therapeutic effects. They certainly can. We have to remember that CBD by itself actually has therapeutic benefits. It's the whole reason why the FDA approved CBD by itself in a form called Epidiolex. It's used for 2 different forms of rare pediatric seizures because they did find that even though it's made with an isolate form of CBD, that it was effective for those seizures. But what we've seen is that full spectrum is actually more effective than isolate or broad spectrum. So that's not to say that broad spectrum or isolate CBD products don't work, but that you will more than likely get greater therapeutic effect out of a full spectrum product.
So we have a question here actually specific to seizures. So why don't we dive in? We have April who's asking her dog Rosie, I like that name, suffers from seizures. She's on 3 meds, zonisamide. I'm not a doctor, so I'm doing my best. Potassium bromide and levetiracetam. Sorry, Dr. Shu, you're going to have to decipher that. She's been using CBD for over 2 years on her pet, and it's helped. She doesn't want to reduce her meds. What do you recommend that she cuts back on?
First and foremost would be that she talked to her veterinarian about it. And this is because it's anytime you're dealing with a medical case and you're dealing with multiple medications, that always has to be under the supervision of your veterinarian. So that is what I would recommend talking to her veterinarian about. I'm not sure what state that she's located in. If she's in California, recently, as of January 1st, 2019, because AB 2215 passed, California veterinarians are allowed to discuss cannabis with their clients without legal repercussions. So California veterinarians are protected. In other states, it's a little bit of a gray area. We do know of a lot of veterinarians that do discuss that with their clients because they feel that they should have that right to do so, because it is information that is out there and it's information that impacts the health and quality of a patient's life. So what I would always recommend is, if you're ever thinking about incorporating CBD into your pet's regimen, or if you're ever thinking that there needs to be some kind of adjustment, always do that under the guidance and supervision of your veterinarian.
So let's come back. We jumped off for a second. We were talking about the COAs. Can the average consumer find or see a COA? And I've got it up on the screen now for everyone to see. Dr. Shu, can you see that? I just want to verify for everyone.
Yeah. And so this is a COA. This is a certificate of analysis. And what's important to understand is that a certificate of analysis can contain a number of different tests. So what we do is we do what's called a triple testing procedure. So when we get our raw ingredients, whether it's the organic extra virgin olive oil that we use, or it's the extract oil that we use, we always test that for a number of different things like pesticides, solvents, heavy metals, microbials, mycotoxins, to make sure, first and foremost, the material that we're dealing with is premium quality material. During a manufacturing check or the manufacturing process, we'll do a potency check to make sure that whatever is on the label is actually what's going to be in the product. And then what we do is, once everything's batched up, we'll do another final check. Now, this is the most important part. What we do with this last check is we test not just for the cannabinoid profile, but we test for pesticides, solvents, microbials and bacteria, mycotoxins, and heavy metals. And we do this on every single batch that gets produced. Now, this is something that's really important because when you're looking at a COA, it should correlate with the batch that you have in your hand. So for us, when you go to our website, vetcbdhemp.com, you'll see that we have a page that lists the COA for every single batch. So you should be able to correlate the batch that you have with the COA that's posted there. And so what you see here is, if you go back one page, you'll see all the different tests that we ran this for. So we ran it for the cannabinoid profile, the microbials, the pesticides, the mycotoxins, the solvents, heavy metals, and then they do some other analyses, like they'll do a visual inspection of foreign material. And so this is something that's really important, because you want to make sure that every single batch of product gets tested for this, so that way you're making sure that it's safe, clean, and consistent every single time. And so a COA should be either provided to you or available on a producer's website for every single batch that gets purchased.
Is it safe as a consumer? And I'm not a doctor, so if I went and I said to whatever manufacturer or retailer, hey, I want to see the COA, and they said, we don't do that, or we're not going to make that available, would you recommend that I steer away from that product?
I would, because here, the tricky thing about the hemp industry is that the hemp industry is not regulated to undergo any sort of formal testing for the final product. That's different on the cannabis side. On the cannabis side, every single batch of product has to be tested for all those things. So on the cannabis side, or on the hemp side of things, there's no regulation to test for all those things. So it really is up to the manufacturer what they want to test for and how frequently they want to test for that. And so, my opinion is that every single batch, there's no reason not to test for all these things. Yes, it gets expensive. Yes, lab testing is a costly expense, but the reality is that when we're giving this to our animals, we want to make sure that every single time it's safe, clean, consistent.
So one of the other things that when I looked at your product, and what struck me was this that you can see on the screen now, that it says full spectrum right there. Any product that is, and you've talked about full spectrum just now, any product that is full spectrum, I assume they label their products this way. Yeah. And if I didn't see full spectrum, the same question with the COA: should I steer away from that, or what as a consumer should I be looking for and doing?
Yeah. So, I mean, the thing is that there is not a legal or scientific definition of full spectrum. Full spectrum is kind of what the market has come up with to help the market itself and the industry itself, and also the consumers understand the differences. So the general consensus is that full spectrum is the most raw form of extract from the cannabis plant that contains multiple cannabinoids, including THC. Broad spectrum is that with the THC removed, and then isolate is just a pure cannabinoid. And so if a company chooses to put full spectrum on their product, it could be something else. And what will tell you what it really is the COA that correlates with that batch.
So let's talk about because you had mentioned THC and full spectrum. We actually have a question here from Colin that says he's concerned about the psychoactive effect of full spectrum on his dog,
Yeah.
especially in higher doses. He's wondering if there's research on incremental benefit of full spectrum versus broad spectrum, and what he should be thinking of.
Yeah, great question. And so with THC is very, very interesting because even when I was going through vet school, we were only taught about cannabis in toxicology class, meaning that we were not taught about the endocannabinoid system. We were not taught about the potential benefits of cannabinoids. We were only taught that THC was dangerous to animals. Now, what we should understand is that THC varies in effect based on the amount that's given. So what that means is that at very, very low levels in both humans and animals, it's actually not going to be psychoactive or intoxicating. It's at higher levels that it can have that intoxicating effect. So for people, if people are going to take really small amounts of THC, especially in conjunction with CBD, then they don't get high from it. They don't feel those high effects. And it's the same thing with animals, is that when animals are using very low amounts of THC, they actually don't feel any sort of intoxicating effects. And especially in combination with CBD, because what happens is THC is what's called a partial agonist of the CB1 receptors, and it's binding to the CB1 receptors in the brain, and that is what causes things like decreased pain, but it can also cause things like intoxication or feeling high at higher levels. So it's a question of the threshold. And once you reach that threshold, that's when those side effects can occur. And so what's really, really important is that if we're using THC, then we use it in amounts that are low enough and in conjunction with CBD so that these animals aren't getting high from it and they're not feeling any sort of intoxicating side effects from it.
What comes to mind, and I'm going to apologize up front, Dr. Shu, because I know I'm sort of stealing your thunder a bit here, but we were going to talk about dosing, and maybe this is a time to touch on that. We can talk about it a little bit more later on too. But since you talked about what your pet's feeling, and I remember you saying, "Hey, start low until you see an effect, and then what?" You'll better describe it than I. But could you touch on that and maybe what Colin should be looking for if he's got THC that he's giving his dog?
Yeah. So in general terms of dosing, when it comes to cannabinoid therapeutics, what we do is we start low and go slow. So what we do is we have a dosing guideline that goes by body weight, and that is the recommended dose that most of the patients will take when they're in that body weight. But what we've seen in both humans and animals is that every patient can use and utilize a different dose. Some patients may need a higher amount. Some may be able to use a lower amount. And so what we do is we provide a dosing guideline and we say, start at half of that recommended dose and then gradually increase it. And so what you're looking for is you're looking for resolution of clinical signs. And so, for example, what we see is if a patient is discomfort, if they're using it for that, or if they're using it for anxiety, what we look for is resolution of those signs. So are they having difficulty getting around? Do they have decreased mobility? At what dose are we seeing that they're starting to have increased mobility? And at what dose are we starting to see them be more comfortable? And the same thing for things like stress and anxiety is we look for the clinical signs. So for example, with anxiety, sometimes they'll pant excessively, they'll have their ears back, or they'll shake, or they'll hide. And we look for resolution of clinical signs. And so again, starting at a lower level and gradually increasing it until we find that it's most beneficial for that pet. Because what we're trying to do here is we're trying to use the lowest dose that provides the maximum benefits. We don't want to use too low a dose and leave some potential benefits on the table. And we don't want to use too high a dose and use much, much more than we have to. And in terms of the THC amount, it's very, very, very small. So it's not anything like what you would find in terms of like a human edible or a human product. It's much, much smaller than that. And especially in combination with CBD, CBD actually counteracts some of the potential side effects or some of the intoxicating side effects of THC. And it does this by interacting with the CB1 receptors and preventing some of the THC from interacting with those CB1 receptors.
Great, thank you. So we went off on this tangent, which was a good one. I want to bring us back to, we were talking about the product and what we as consumers should be looking for. Now, giving pets CBD out of a bottle, I've used others and it gets messy, it's hard, or it's glass or whatever. And one of the things that struck me when we were looking at your products, Dr. Shu, was and I'll bring this up right now on the screen is that you have something different that you use to administer the product. Could you talk about that a bit? Because I loved it.
Yeah, thanks, Jason. And so, what we do is, for us, we want to make sure that pet owners are able to get accurate dosing every single time. And so that involves accurate measurement of how much you're pulling out of the bottle and how much you're administering. So what we've seen with the rubber droppers that we see in a lot of these types of products is that, one, they're made out of glass. And so you definitely don't want to be putting glass in your pet's mouth. You definitely don't want them to be biting on glass accidentally. But it's also the thing about the rubber droppers is that they're hard to accurately measure. A lot of times what we've seen is with the rubber droppers, they get a lot of air in it. And it makes it hard to measure and it makes it hard to administer because it's hard to get it out completely. So what we've done is we've utilized these oral syringes and we have a system where it's the bottle is spill proof. So once you take off the cap, you can turn it upside down and it's not going to spill out. So we have a little orifice reducer in there that prevents that from happening. And then you insert the oral syringe in there, and then you're able to withdraw accurate amounts. So whether it's 1 ml or 1.25 ml, you're able to make sure that you get accurate, consistent amounts each and every time.
Cutting nails, grooming, it is tough enough trying to get a dropper or, even putting glass near our pets. When we saw this, it was a huge help. So that's a little thing, but it's a really important thing. So anyways, when I look for products, this is what I'm looking for. But we talked about a lot, and Dr. Shu, you brought things together, sort of a little checklist that I accidentally showed a little prematurely there. But can you walk us through this checklist of, what we should be looking at and considering, how to choose, basically?
Yeah, absolutely. So, when we're thinking about, what we want to use CBD products for is, there's a lot of people that have claimed that, either cannabis or CBD or hemp can be used for just about anything and everything. And we want people to understand that that's not the case. The cannabis plant is an amazing plant, packed with so much potential, but it's not a panacea, meaning that it doesn't treat everything and anything out there. So first and foremost, what you want to do is you want to go to your veterinarian, make sure that you have the diagnosis of what's going on with your pet. You don't want to guess. You don't want to be Dr. Google. You want to make sure that you leave the diagnosis to your veterinarian so you know exactly what you're dealing with. And then you talk to your veterinarian about incorporating CBD, cannabis, or hemp into their regimen. Because like I said, there are some specific things that CBD is very, very good for. But we have heard of a lot of different marketing claims about, using CBD for this or that, and a lot of them are unproven. So you want to keep that in mind. The other thing that you want to keep in mind is that a full spectrum product is going to outperform something that's an isolate product. Again, that's not to say that isolate products aren't going to be effective or they don't work. Sometimes people are limited by their choices. And certainly we have seen isolate products work in certain cases, or broad spectrum products. And we have seen full spectrum products work very well. So, it just depends on the person and what their choices are. But my recommendation is, when we're looking at what's most effective, is full spectrum products have been shown to be more effective than isolate products. Now, in terms of when we're talking about, how we're giving it, typically what we do is we give it internally. We give it orally by mouth. Now, there are some potential topical uses. For example, if there are some certain skin conditions, then that may have topical application. But in general, when we're looking at using something that is going to affect the entire body, then we're going to look at using it internally, given orally. But we are actually exploring some topical applications for some of our clients out there. If you guys want to get in on that potential trial, shoot us an email. We'd love to help you guys out however we can. And in terms of ease of use, certainly the way that we've set it up, it's spill proof, and you have a oral dosing syringe that is not glass, so it's not going to break in your pet's mouth. It's easy to give orally directly, or easy to put directly onto their food. And then in terms of cost, you want to understand that, a lot of times you get what you pay for. Quality never comes cheap. So you want to ask yourself, what is the product made of? Are they using premium ingredients? Is it human grade? And also, is it full spectrum, or is it isolate? And do they do lab testing? Because like I said, there's no reason why a company shouldn't be able to lab test thoroughly every single batch of product that they produce. And when I say lab test, I don't mean just looking at the cannabinoid profile. I'm talking about doing that full barrage of lab tests. For each and every batch, it should have a cannabinoid profile, pesticide testing, solvent testing, heavy metals, bacteria, and mycotoxin testing. So that way, you're getting good quality product every single time.
So one of the other things that we touched on, but I really want to recap again, is this dosing? Because that's a big question. I still have that question. You've answered a lot of it, Dr. Shu, but can you go over dosing again, just to make sure we're all crystal clear on it?
Yeah, absolutely. And so, it's really easy acronym to remember is GLASS: go low and start slow. And this applies for humans that are using cannabis and learning how to use cannabis as well. Go at a low level and just gradually increase it slowly until you're finding your optimal dose. Because what we've seen over the years is that we can have two dogs that are 70 pounds each, that may be using it for things like discomfort or mobility issues. And one dog may be using, say, 2 mLs of our product and only using it once a day. And the other dog that weighs exactly the same, that's using it for the exact same thing, may actually have to use more, say 2.5 or 3 mLs, and they may use it 2 or 3 times a day. So it really depends on the individual. Every individual is different. Just like how you and I have genetic differences, animals have genetic differences as well. And each individual is going to be unique. And so what we want to do is start at a lower level and gradually increase it until we see the optimal effects.
Distilling everything that you've talked about, what I've heard. Number one, talk to your vet and get a diagnosis. I mean, that's similar to humans. Talk to your doctor. Same thing applies here. You've given us a lot of good information, a lot of things, but again, start with your vet and then apply thereafter. The checklist was great. Thank you. And this whole webinar will be replayed, so you'll have access. Anyone who's listening, you'll have access to that checklist. No worries. And I found it really helpful too. Remember, CBD doesn't do, it's not a panacea, to use your word. So keep that in mind. But I got to tell you, and here's a quick story. The guy that cuts my hair, and for those of you can see on video, no, I have not had my hair cut since the beginning of the pandemic. But the guy that usually cuts my hair, we were talking a few months before the pandemic, and we were talking about your products, Dr. Shu, and he has a very anxious Chihuahua. I was telling him about vet CBD and using CBD for his pet, and he lives down in LA. And he said around the 4th of July, that when we had the fireworks, his Chihuahua goes crazy. And as soon as he gave his Chihuahua, CBD, it calmed her right down. And I know it doesn't fix everything, but man, the dramatic effect it had on his dog, and he had tried it before and he had stopped. That's why I'm saying he tried it at the 4th of July. For some reason, he stopped. And when I talked to him again, he started up again. And I just heard from him about a few weeks ago, and he said he wished he had never stopped, because now his dog is back to being very chill and balanced. And so he's definitely not going to take your back off the CBD. So, I'm not a doctor, I'm not making a claim, but man, he's thrilled with, applying that CBD and the effect it's had on Maddie, is his dog's name. And sorry, back to our conclusion. So full spectrum, definitely, biased toward that. Full spectrum is what I heard. And make sure that the products are made by a vet, formulated for pets. Because I have heard of some people giving their dogs human stuff. And I would assume, Dr. Shu, that's not a wise idea.
Right. So you don't want to give your pet stuff that's made for people. And there's a couple of reasons for this. First is we don't know if the ingredients are going to be pet safe. While there's a lot of ingredients that humans use that are safe for animals, there are some that are not. Animals are very specific, and some things like, just an example is humans can eat chocolate all day long, but dogs cannot eat chocolate. And so, there's other examples out there, but that's why you want to make sure that it's pet specific. And the other reason why is because the dosing and the concentration are really, really important. You don't want to use something that's formulated for humans and then accidentally give your pet way, way more than what you should. And so that's why you want something that's made specifically for pets, and you want ideally for the person that's created it, that's formulated it, to be a veterinary professional, because animals' physiology is unique to humans. Granted, things are very similar. Most of us, we're all mammals, and most of us are vertebrae in terms of the pets that we're treating. But animals have their unique physiologies. The other thing is that, for example, with our company, we have veterinary nurses on our team. So that way, if anyone has any questions, they're able to call us or email us and speak to veterinary professionals. And sometimes they're veterinarians. We talk to their veterinarians and, provide them information and education about cannabinoid therapeutics.
So let's get into questions. We got a lot of questions. So buckle up, Dr. Shu, because here we go. Can I use CBD with a puppy? What is the best case to use it for and with them?
It depends. It depends on what someone's trying to use it for. Certainly there are a lot of applicable uses, whether it's a puppy or an adult. But a lot of times we get that question, and when we dig a little bit deeper and when we ask the pet owner, what they'd be interested in using it for a puppy, a lot of times they're saying things like, oh, he's just rowdy all the time, or he always wants to play. And our answer is no, you never want to use it for that. The answer for that is play with them more, exercise them. They're puppies. That's what they do. And then some other things, behavioral things, we always recommend behavioral therapy, right? Because, CBD is great for a lot of things, but if there are other things that can be utilized to help out, sometimes that is a better option, so it really depends on what they're using it for. But I would recommend, first, whatever they're thinking was going on is to get a diagnosis with their veterinarian, and talk to their veterinarian if that's an appropriate solution for their situation.
Next question is, will CBD help with canine cognitive disorder? And can you recommend any Northern California, vets that will discuss CBD?
That is a great question. And what we are actually doing is we're actually trialing a new formulation that specifically addresses things like neurodegenerative disorders. So, animals can have a lot of similar diseases to humans. And we know in humans, there is a lot of interest in cannabinoids for things like Alzheimer's and dementia. Dogs and cats, as they get older, they can also get cognitive dysfunction, or what appears to be like dementia or senility. And we have had reports of people using it for that. I've seen it actually myself, with dogs that have improved through cannabinoid therapeutics. And we are actually going to be undergoing a new trial of a new formulation within the next coming months. So if you're interested in participating in that, shoot us an email, info@vetcbd.com. We'd be happy to help you out however we can. And then, if you tell us your location, we'd be happy to, see if there's anything else that we might be able to help you with.
And I'll make sure I'll put your email address at the end on the screen here for everybody. So if you didn't catch that, don't worry. I'll show it on the screen. You can write it down. And of course, it'll be in the replay. So the next question, it sounds like you got a product fan here, Dr. Shu. April says, I know Vet CBD is available only in California. I'm in Texas and I have someone purchase it for me. Any idea when she can expect the laws to change and she can order it online?
So we actually have our hemp line now, which is Vet CBD Hemp. And so she can go to vetcbdhemp.com and we are able to ship it to her in Texas. And then at the end of the presentation, we've got a special code for 15% off.
All right. And yes, I'll bring that up in a few minutes. So we have a question from Cheryl. It's a little bit of a lengthy one. So Cash, my large dog at 100 pounds, yeah, that's a big dog, has dermal hemangioma. Oh boy.
Let me open up this panel and see if I...
Hemangioma acroma?
Hemangioma carcinoma.
Thank you. You saved me. I've been giving him a low dose daily vet CBD for nearly 2 years, morning doses, not the evening doses, for clarification. I apply directly to any of the tumors that come up. I believe that CBD expedites the healing process, as he hasn't had to have any removed via surgery as he did in the beginning. I just want to know, do I need to worry about long-term oral use?
Yeah, great question. And first and foremost, I'm really happy to hear how well it's been helping. I'd love to be able to hear more. So if you want to email us, one of the things that we do is that we're looking at writing up case studies, especially for pets that are using it for cancer. We've seen some really interesting success stories, and we'd love to learn more. So if you can send us an email, we'd really appreciate that. And then in terms of the question in long-term use, the studies out there have have not shown any sort of detriment with prolonged use. Most of the studies out there, however, are only doing it at 4 weeks. But in terms of what we've been doing this for about 5.5 years now, and we've had a lot of clients using it for their pets for a number of years without any reports of any ill effects from long-term use. My pets have also used it long-term as well without any issues.
Glad to hear it's working. All right, we've got another question from Delphina. She has a 6-pound Chihuahua. She's been giving the Chihuahua 20-to-1 vet CBD for 3 years, 3 times a day for arthritis. She's wondering if her Chihuahua will develop a tolerance, and should she be titrating up her dose over time to maximize the therapeutic effect. The dog's 10 years old.
So the really cool thing about CBD is that no study out there has actually shown tolerance issues with CBD. The cannabinoid that actually has shown tolerance issues is THC, but that's in humans, and that tends to be in humans that are heavy users of THC. But in terms of CBD, there actually has not been shown to have any sort of tolerance issues long term. So that's a great question. Now, something that is important to remember is that there are certain disease conditions out there that do worsen with age. So, for example, there's nothing that's curative for arthritis. Arthritis is a disease process that naturally worsens with age. And so sometimes that may be something to look out for, is if there is natural progression in the arthritis or any other disease process. But to answer the question, there's no study out there that has shown that there's any tolerance effects of CBD. And the opposite is actually the case, whereas studies have shown that there is not a tolerance issue with CBD.
We got a pet owner here in California. Their dog's name is Zoe, miniature Dachshund, and had problems with inflammation on her hind legs. The vet prescribed grapirent.
That prescribes something. Yeah.
The owner also rubbed a topical CBD broad spectrum product on her leg. Are topicals good for pets? She seemed to get better.
Yeah, and that's a great question. Now, in terms of humans, we know that a lot of people use topicals, and then in terms of animals, we don't have enough studies out there that have looked at topicals, because the thing about topicals is it depends on the formulation. So there are certain formulations that are going to be better for penetrating the skin, and then some of them that are just going to stay on the surface level of the skin and not actually penetrate through the deeper layers or get into the bloodstream. So it depends. We certainly have actually had some pet owners use our oil tincture on the skin, and the effects of it seem to indicate that it did absorb through the skin and provide a systemic impact, meaning systemic throughout the whole body. So certainly we have seen some evidence that points in the direction that topicals can be effective beyond just the skin, and can potentially improve some of the things that are affected underneath the skin.
I just read this quote. This is a great story. It's a question, but there's a preamble here. The first part of the question, Dr. Shu, is about tolerance, which you've answered, but there's a second part I'll get to. So this is from Mauricio. And sorry if I mispronounced your name. They have an 11-year-old Chihuahua. Poor Chihuahua. It suffers from mitral valve insufficiency, enlarged heart, and collapsing trachea. He's been on vet CBD for 2 years now, as recommended by his vet. We've seen a huge improvement in life quality, less coughing, reverse sneezing, etc. The question is, do pets develop a tolerance? Which you've already said, no, they don't. But the second part of the question here is, should I continue the same dosage of 0.5 mil twice a day, or am I able to increase dosage accordingly?
Yeah, it's a great question, and first and foremost, I'm really stoked to hear how well it's been helping, because that constant cough is something that it really inflames the airways of the dogs, and it can be difficult for them to have a good quality of life when it affects how they get around on a day to day basis. So yeah, the first part, no, we have not seen any tolerance issues develop, and in terms of changing the dose. That is depending on the clinical signs and what the owner is seeing. Certainly, we do have owners that will adjust the dose in either larger amounts for a big dog or smaller amounts for a small dog. But what we do is, again, going low and starting low and then gradually increasing that dose to the point that we see the optimal therapeutic benefits. So we certainly have had a lot of people increase it in very, very small doses to try to see if they get better therapeutic benefits from it. And then now I would always recommend that you do that under the supervision of your veterinarian, because your veterinarian is going to be the one that really helps you understand things like dosing and the clinical signs and how to monitor some of those clinical signs.
Okay. Quick question here. Vet CBD is it an NASC certified product?
Yeah, great question. So NASC is National Animal Supplement Council, and what they do is they're at the forefront of CBD products for animals, and so we are actually undergoing certification by NASC. So that is something that we plan on having in the near future.
All right. Next question. This person's dog is always barking, specifically when left alone. I assume she is anxious. Can CBD help to reduce her barking?
So, a lot of times when pets are left alone, it's dogs are social animals, and they're pack animals, and when they're left alone, sometimes they do get anxiety. And, typically what we call is separation anxiety, and there's a number of things that we look at when we are dealing with a patient that is potentially having anxiety issues. First and foremost is, can we change the environment? Can we modify the environment so to help that patient be less anxious? And sometimes there are things like behavioral therapy. For those that don't know, there are a lot of board certified behavioral therapists out there that are veterinarians. And so that's what I would always say is, if there is some sort of behavior issue, talk to your veterinarian first and foremost, because a lot of times what we've seen over the years is a veterinarian may be able to see and understand things from a medical perspective that a pet owner may not. And so veterinarians are essentially the voice of these animals and these pets. Now, having said that, we do have a lot of clients that use it for things like separation anxiety and noise anxiety, because what's remarkable about CBD is that it specifically has what's called anxiolytic properties, meaning that it removes the anxiety, and it does this without sedating the patient. Now, caveat is, a lot of people ask, can CBD have side effects? And the answer is potentially yes. So that is one thing to always realize, is that anything out there can have side effects. Now, fortunately, the potential side effects with CBD tend to be very, very mild. So one is sedation. So a patient can feel maybe a little bit more sleepy than normal, and another is diarrhea. So those are two potential side effects of CBD. And we see that both in humans and animals. Now, going back to what I was saying, we do see a lot of pets, humans, that get stress relief and anxiety relief from CBD. Primarily, the reason why is because CBD interacts with the 5-HT1A receptor, which is a serotonin receptor, and it also prevents the breakdown and reuptake of anandamide, which is an endocannabinoid in our own bodies that contributes to that blissful, happy feeling that we get.
All right. So, Dr. Shu, we're at time and we promised to give everyone the discount code. So, can we do this? Can I put the discount code up on the screen, and could you stick around for, say, another 5 minutes and answer a few more questions? We got about a dozen, but we'll get through as many as we can. Is that okay?
Yeah, absolutely.
All right. I'm going to put we promised that by the end of this, we would put up the discount code. So, I'm doing that right now for everyone to see. And you'll see the code is Dog Day. And that's good for 15% off at vetcbdhemp.com. Again, that code is Dog Day. So there's the code. I hope you all stick around because we still have some more questions, and I'll come back to the video here. So moving on to the next question. My 5-year-old cat has very mild, has been diagnosed with very mild asthma, brought on by most of the time when pestered by his younger brother cat. Poor guy. Is there research for CBD for asthma, and does CBD have a positive inflammation response?
Yeah, great question. So, not to my knowledge, I haven't come across any studies that have looked at CBD specifically for asthma. Now, in terms of does CBD have a well, the wording here is positive inflammation response, but the question really is, does CBD have an anti-inflammatory response? And the answer is yes. So study after study has shown that cannabinoids like CBD and even THC have an anti-inflammatory response. Now, whether that can be used for patients that have asthma, that remains to be seen. There's no studies out there in humans or animals that I've come across. We have had pet owners report to us that it's beneficial. In theory, that would make sense because of the anti-inflammatory effects of CBD. But there's not any studies that have looked specifically at asthma.
Next question. Can you explain the differences in your three vet CBD products?
Sure. So on the cannabis side, we have two formulations. We have our 20-to-1 formulation and our 10-to-1 formulation. And then on the hemp side, we have our full spectrum hemp product. On the cannabis side of things, the 20-to-1 formulation is our general cannabis formulation. The 10-to-1 formulation is what we consider the extra strength formulation for pets that may get a little bit more benefit out of that higher ratio. And so the difference is that on the hemp side, that one is available through our website, and that one can be shipped directly to people's homes.
Question from Anonymous. What is the ideal way of administering CBD via the included dropper? I usually administer along the side of the mouth of my dog in between her gums and lips. Does the dose become less effective depending on the method?
Yeah, great question. And so, what we've seen in some recent studies is that when cannabinoids are given with a meal with food, there tends to be a little bit better of an absorption rate. So, and now granted, not everyone can time that. And so we do have people giving it both ways. We do have people, for example, if, they need it like an hour before an event, they can't necessarily just feed their dog an hour before that event. And so they'll just give it orally. And we've seen that work perfectly fine. And then, we do have some people that give it with their dog's food and give it with their meal. Some of the studies that have come out in both humans and animals have shown that if it's given with a meal, then they do actually absorb more of that CBD. But we do have a lot of people that just give it orally directly into the mouth, right between the lips and the gum, right in that cheek pouch.
All right, I think we have time for one more question, and I apologize to everyone that asked questions that we couldn't get to. We appreciate it. So the last question here is, how do you measure or gauge the optimal effect for my pet?
Yeah, great question. So the thing about animals is that they can't talk to us, unfortunately, until we make a voice box translator like in the movie Up. Hopefully we get that someday soon. But because they can't talk to us, what we have to do is we have to rely on clinical signs. So the example that I give people is, when we're looking at a dog with arthritis, we want to know, what degree of lameness do they have? How much is that arthritis affecting them? Are they having difficulty getting up? Do they not put any weight on that leg, or do they put minimal weight on that leg? If they go for walks, how far of a walk are they going for? Is it just down the street, or is it like a mile? And so what we look for is we look for those clinical signs. And then what we see is if we see improvement in those clinical signs, then we'll be able to say, okay, this dog was previously only barely putting any weight on that leg. And now that dog is putting full weight on that leg and having a mild limp or having no limp at all. So what we do is we look for these clinical signs, and we look for improvement or resolution of those clinical signs to know if a treatment modality is working or not.
So, Dr. Shu, we promised also to put up an email in which they can reach out to you and your colleagues at VetCBD. So info at vetcbd.com is your email address. So I'm assuming anyone that needs to reach out and talk to you can do it through that email. Yeah.
Yeah, absolutely. I see, there's a number of other questions that we didn't get to. We'd love to be able to, get back to you on these questions. So shoot us an email. We're happy to talk to you. And then, we also have our phone number on our website. You can call us at any time. We have a team of veterinary professionals that answer the phone and the email. We've been in the veterinary hospitals. We've been in the veterinary field for a very long time. And we're super stoked and super happy to be able to be in the cannabinoid therapeutics industry now. So really appreciate everyone hopping on and asking all these questions. We'd love to be able to get to answer the rest of your questions.
Okay, so as a quick wrap up here, here's some quick information you need. If you want to find the replay, it will be on throughwells.co. And we'll also share it with our friends at VetCBD, so you'll be able to find it there. And here are a couple URLs for you. Also, upcoming webinars, technology transformation in CBD and cannabis, in case anyone's interested in tech. And we'll be talking about the new world of CBD and CBG, some cannabis topicals for humans, not pets, and some vegan. We'll be talking about veganism, and again, for humans, not pets. Veganism, and cannabis. So, with that, stay apprised of everything that's going on with Dr. Shu and VetCBD at their website, and you can stay up to date on everything that's happening at Three Wells for the human side and pets as well at throughwells.co. So, with that, Dr. Shu, thanks a lot for going over time here. It's been a wealth of knowledge. I learned some more tonight, even beyond our conversations before this evening. So thanks again. It was great. And for everyone who's been listening and stuck with us, I hope you got everything that you needed. And thank you very much for your time tonight. Go be safe, be healthy, be happy, and enjoy life. Have a good night, everybody. Take care.
Thanks, everyone.